You feel like you want to go to the loo?
So we've had to stop the treatment because he needed to go to the loo. So I'm not sure if we're going to get a result or not, but let's see what happens. I've never been excited to know if someone's done a wee or poo or not.
So we've got a case here today where we have a patient who's got quite a distended belly, meaning his belly is quite kind of full, and he's suffering with constipation. He's not been not been properly for a couple of weeks now. He's been going, but he doesn't feel like he's emptying out properly, and he's been prescribed a lot of laxatives basically. Now, long-term use of laxatives is not great. It doesn't really help with constipation in the long run, because the laxatives, usually what they do is they make they make the stool soft. And I want you to understand a really important thing, that the bowel is a muscle. So if you think of a muscle, and over time what happens is if you're using your bowel normally, you'll have stools which your muscles are using to push through. So they have some resistance. So the muscles are being used when your bowel's functioning normally. So again, like I said, the bowel now is trying to move things along, but it doesn't have much resistance, because it's like a toothpaste tube, right? It's just all mush inside, and you're not really going to evacuate properly again when the stools are all mush. If the stools are well formed, then your bowels can transport that and they can move things through it. If the stools are all mush, which is usually the case when you're taking laxatives, then it's very difficult for your bowel to actually evacuate properly. So long-term use of laxatives is not really the solution. You need to train your bowel and get the muscles in your bowel to function properly and strengthen up to be able to evacuate properly. So we're going to try and encourage the bowel to function a little bit better by using some manual techniques and by using some cupping, which is going to stimulate the bowel muscle by stimulating and creating an artificial stress or stretch to the bowel muscles. The bowel muscles have got a lot of receptors in them, so when we get any form of stretch or stress to the tissues, it stimulates the bowel and it can help the bowel get moving. So we're going to start with some of that now. Okay, so there's a lot of gas in your tummy as well. So this is your descending colon. All sounds hollow, the transverse colon.
Well, lately I haven't been passing.
You haven't been passing gas? Yeah, okay. So what we're going to do is we're going to start off with just some very light manual techniques. And this is something that you can do yourself, okay? If you suffer with constipation, or if your bowel's not functioning as well as it could, self-massage techniques are actually really, really good way to help yourself and help your bowels get moving. Another important thing that you can do is exercise. If you're sitting around, or if you're desk-based, or if you're laying in a bed because maybe you've got tummy pains or whatever it is, that's really the last thing that you should be doing. If you have a bowel which isn't functioning properly or is not as active, the best thing you can do is get it moving. Okay, so physical exercise is really important. Breathing techniques, if you use abdominal breathing techniques, they can be helpful. And when there's a lot of gas in the system, it can be quite difficult to empty it out, because even if even if your bowel is emptying and you're passing stool, sometimes you can have air which is trapped within your bowels for quite a long time. And this is when treatments and techniques such as colon hydrotherapy can be quite useful, because they can help alleviate and kind of get rid of gas that's built up in your system, as well as helping your system flush out. Nice deep breath in for me. Okay, and out. Okay, and in and out. So I'm using the breathing cycles just to get a depth. If you're suffering with IBS or you have issues like that, then often what you'll find is you might work into the bowel, or you'll feel into the bowel, and you'll find some areas which are really, really painful. Now, usually when they're quite painful, and provided they're not anything kind of sinister like appendicitis or anything like that, and that it is all of those other things have been ruled out, and it is just purely kind of IBS, what usually happens is just like you have a muscle knot anywhere in your body, you have a muscle knot in your bowel. And that muscle knot can cause quite a lot of problems as well. That can be the cause of a lot of pain and the discomfort which is associated with IBS, and the tummy cramps that go on. So again, muscle techniques are useful, manual techniques are useful. People often use heat. If you have IBS and you're wondering why using a hot water bottle helps your tummy, it's helping because it's helping relax the muscles. But there's lots of other things you can do to relax those muscles. Are you okay, Uncle?
Yeah, fine.
Good. So we've got the suction cups on now, and what these are literally doing is they are lifting up different portions of the tissue Now, obviously this is working on the skin, it lifts up the skin, but it's also lifting up the layers of fascia. And these layers of fascia, we've got a big fascia kind of layer that goes over the tummy, the greater omentum, which is a big fascial kind of sheath that goes across. Now, when we're lifting that up, the body is very receptive to the stretch responses that it's receiving from the cups. And what this can sometimes do, it can translate into the tissues itself or into the bowel itself, and it can make the bowel feel like the tissues are being stretched. Now, in any other situation, the only thing would ever stretch your bowel would be if your bowel was full. So this is kind of tricking your body into thinking that the bowel is full and that your body needs to do something to get rid of it. So what starts to happen is the bowel starts to initiate a process of peristalsis, and the muscles start working, or we're trying to encourage the muscles to start working. So this is the theory and the basis of how this works, and I've seen it in practice very often. When we put the suction cups on, you can literally hear kind of all the gurgles and everything happening, and the bowel starts making some funny noises. So I've seen this in practice, and I've seen it happen where as soon as you put the cups on, that happens. It doesn't happen all the time, it all depends on where the patient's at and what situation they're in. But that's exactly what we're doing here. So we're going to continue this over a course of the next few treatments. So we'll work once a week at least. You can work more frequently if you're working with this sort of thing, and especially if it's chronic kind of constipation and you really want to help things move along, then you can combine it with manual techniques as I've done today, as well as using the suction cups as well. So this is kind of the method that I would normally use with this. Now, if it doesn't help, then I would look to obviously progress that patient on to potentially look into using techniques such as hydrotherapy or enemas or different things that can help. Even water enemas can be useful. So this is how we manage it. So I hope this is useful and that you're able to maybe put some of this in practice with your patients.